Welcome back. Sean Hegarty in for Jeff Smith this afternoon. Recently, we got a chance to sit down with Lieutenant Governor Mary Taylor. Talked a lot about very different issues, but we started out with unemployment. Statewide, the numbers are starting to go down, but in the city of Toledo, we're still hovering around 9%. I wanted to ask her what would be done here locally to make sure the numbers in Toledo go down.
Well, statewide as a whole, our unemployment rates declined from 9% down to 7.2%, and statewide, the private sector has created over 160,000 jobs since we took office. Specifically in Toledo, the infrastructure improvements and the major road construction helps. We're partnering or working with local governments, the mayor in particular in Toledo, to look for opportunities to expand business here in Northwest Ohio, in Toledo, or to help new existing businesses grow, continue to lower taxes, get rid of regulations that stand in the way of business. The things that we would do statewide, I think in particular, are important for Toledo. Is
there any reason why the Northwest Ohio numbers haven't trended as quickly and as well as the statewide one?
Well, if you know, when you travel the state, every part of our state's a little bit different, and depending on where you were, you kind of have a little further to go. So unfortunately, there are still counties in Ohio that certainly have higher unemployment than we would like from a county perspective. But it's good that things are moving in the right direction from a state perspective, and we just need to make sure that we stay in contact with the local communities here and find out what it is they need to help grow jobs.
Is there one particular roadblock you're seeing to job creation at this point?
It's hard to say there's one particular. I think that when we came into office, we felt like that there were multiples of them, and those are the things we're trying to stay focused on. Regulatory reform through our Common Sense initiative, making it easier to do business in Ohio, making it easier to create jobs in Ohio. Our workers' compensation system, for example, was an impediment to small business, and we're still looking for ways to improve our workers' compensation system. The $1 billion refund, that's a great step. Giving back to small business owners and governments, local governments, 56% of what they paid into workers' comp last year, making sure that that system is operating and running as efficiently as possible.
One thing I hear from local governments is that they have some issues with the state not giving them as much as they have in the past, as much as they need to operate well, while there is big surpluses within the state. Do you think enough's being done to make sure that local governments get what they need?
Well, this last budget that was just passed in the legislature had $1.75 billion new dollars to schools and local governments. And of course, I already mentioned the workers' compensation rebate. I think the mayor said here in Toledo they received a $2 million rebate. So it's looking at all of our programs and looking for opportunities to not only help businesses, but to also make sure that we're doing what we can for our local governments. And I think the workers' comp refund, the additional money in the budget should all hopefully be helpful to these local communities.
Do you feel like you need to always stay in communication with the communities to make sure that while the state needs to do its business, that the local communities make sure that they're continuing to do theirs as well?
Well, I think it's good for us to stay in communication because there are opportunities to partner, for example, on bringing a new business in or helping a local business expand, looking for or making sure that we are helping with what are the local priorities. And it's the local community and local government leaders that can help us with what those decisions are.
What do you foresee as the impact from the federal level when it comes down to the state level, the healthcare law? What are you anticipating that's going to do for Ohioans?
Well, just in the last 2 weeks at the Department of Insurance, I'm the director of the department, we finished reviewing all of the health insurance plans that were submitted to our department to be sold on the Federal Health Exchange under Obamacare. Because of the new mandates and the new rating requirements, premiums in our individual market will go up on average 41%. And premiums then in our small group market are going to go up 18% because of the new mandates under Obamacare.
So what can be done then for people, in your opinion?
Well, what we're going to continue to do is do what we can to keep a competitive insurance market in our state. The reason our premiums are going up more than some states, we previously had a very competitive market with over 60 companies selling health insurance in our state. We had consumer choice, where consumers could purchase the type of product that they wanted, the insurance that they wanted at the cost they could afford, or what they actually needed. And now we're all being squeezed and being forced to buy mandated coverage, which is going to drive up the cost. So we want to foster foster as best we can a market that stays competitive, which helps drive down costs, and then continue to listen to small businesses across the state of Ohio and look for other opportunities to make it easier for them to lower the cost of health insurance that they're paying to provide for their employees.
Okay, so if we had 60 companies before, how many do you think we're going to have competitively selling?
In the individual market, we have 12 on the exchange.
Okay.
So we will have, a market off the exchange that will still exist, and we're just now starting to review those plans. But we had 60 companies in the market overall before, but only 12 on the exchange.
What is your opinion on what this is going to mean for the average family here in Northwest Ohio? Do you think they're going to take a big hit?
Well, what we've been saying from the department's perspective, and we had a study, we hired actuaries, we looked at our market, and we looked at what was going to happen, to Ohio after all of the Obamacare mandates were implemented, and in fact now we have the numbers. Premiums are going to go up on average for Ohioans. Now there will be some Ohioans who will reduce costs. Those that are sicker or older will have potentially some reduced costs, but if, for example, you're a 30-year-old male purchasing health insurance in our Columbus market, you're a non-smoker, you could see premiums rise 400 to 500%. So it really does matter, where you are in the state and who you are.
Do you foresee any way that those rates wouldn't climb as high as you think they will?
Not under the Obamacare mandates. Every state's required to, comply with the same mandates. Every insurance policy sold has to have a coverage in 10 essential health benefits as defined by the law. We have new regulations we have to comply with on how you rate premiums, and based on all of the new mandates, premiums are going to go up in Ohio. The best solution for Ohio would have been to allow us to come up with our own solution. Yes, we should have looked at covering folks with pre-existing conditions. It was something that we should have taken care of. And we could do that, but keep our market open, keep it competitive, and give consumers choice so they can purchase what they need, what they want, and what they can afford.
Okay. Do you see the state trying to challenge it any further than where it stood right now?
There's not any legal challenge that the state has brought that I'm aware of, not for anything from our perspective with regard to this bill. I mean, I think, what we've said before is we need members in Congress and other folks in the administration in Washington to understand that this has a serious detrimental impact on Ohio, on our small businesses, on Ohio families, and we'd like for them, to hear our concerns and take actions at the federal level to give us the flexibility we need here.
What do you think this will do for the economy? If the numbers are trending in a positive direction, what do you think it would mean to add 41% more in premiums for health insurance?
Well, anytime you increase the cost of doing business, for example, for our small business owners, you make it harder for them to innovate new technologies or grow their business or employ more Ohioans. They have to have an understanding of what their future costs are going to be before they make decisions about investment. And clearly, anytime government drives up their cost to do business, it's going to impact their hiring and their competitiveness.
And that would just continue on, you think? You don't think there'd be any way to try to come up with some sort of solution for those small business owners, or they just might have to just take the hit for it?
Unfortunately, at this point, our hands are kind of tied with what the federal government's requiring. I mean, they have mandated coverage. Everybody has to purchase coverage, and if you're an employer over 50 or more employees, you have to provide coverage. Not only provide it, but provide the type of benefits that the law requires. There's penalties and taxes if you don't get the coverage or provide the coverage. We're all required to have the same benefits regardless of what our needs are. And so there isn't the flexibility that we need to develop an Ohio solution. And I think unless action's taken in Washington, this is going to be something that we're just going to have to deal with, and it's not really good news for Ohio consumers, and it's not good news for Ohio small businesses.
Overall, though, the positive for the plan would be that more people get coverage and more people that have pre-existing conditions can get coverage. So does that balance work out well?
Well, I'm for more Ohioans getting access to coverage, but the way you make coverage accessible is that you have a competitive market where you have competitive pricing and you give consumers choice so that they can purchase the type of products that they need. In the end, yes, there are going to be subsidies paid to taxpayers to purchase insurance, but that is not free and it's not without cost. It's going to cost the federal government, which means everybody who pays federal taxes, $100 billion by 2016. We're not reducing the cost of health insurance. The government's just using other federal tax dollars to help people purchase it. We should have reduced the overall cost of health insurance.
What is your take on if the federal administration does decide to move on immigration reform, if they allow more visas, allow more workers to stay, what do you think that would do to Ohio?
There are Ohio farmers, and I've talked and met with some of them who are impacted by our countrywide immigration laws, immigrants who work on the various farms in the state of Ohio. So it definitely does impact our businesses and small businesses in our state. Either way, the immigration policy impacts them, and there are other businesses in our state that are impacted, those that are not able to get the type of help that they need right here in Ohio. The governor, I mean, from our perspective, we'd like to see Ohioans train for the jobs that are available in our state, and that where we have new opportunities, for example, in the eastern part of the state with the shale drilling, what programs are we putting in place in our 2-year and 4-year colleges and our high schools to better train Ohio workers to take these jobs that are available?
So do you think it's a good idea or a bad idea to extend the amount of visas that are issued?
I think that we have to look in certain areas at how many visas we have, work visas, and the needs that we have in this country to address. There are some particular industries who are especially hit by limits on visas. And so I think from a federal perspective, it's something they need to work on. From a state perspective, again, we need to be looking at training Ohio's workers to take the jobs that exist here in the state and make sure that our farmers have the type of employees or the level of employment that they need to get their jobs done.
Do you think our workforce is trained for the future, or do you think it needs retraining, reworking as we go forward? Maybe shale is the future.
We are making progress towards retraining our workforce. Yes, I think we've made progress, but yes, there's more to do. It's identifying the needs that exist in the businesses, having businesses tell us what are you looking for? Do you need skilled labor? What type of skilled labor? Then are those programs available in our college, 2- and 4-year colleges, or in our career centers across the state of Ohio? How do we better partner with our universities, colleges, and career centers in our businesses to make sure that we are properly training that workforce? And I think, again, in Eastern Ohio with shale, it's a good example of all parties sitting at the table and identifying what the need is and then looking for a solution.
Mm-hmm. As you look back at the Jobs Ohio program, one of the knocks on it has been transparency, trying to figure out what exactly goes into it. What is your take on where the program has gone now and where you think it needs to go in the future?
Well, we've created the private sector has created 160,000 jobs since we took office. Jobs Ohio is an integral part of helping to identify, locate companies who want to expand their operations and look to come to Ohio. They're part of, businesses talking to business. It's folks with relevant business experience going out and talking to their counterparts. They're equal at a company, for example, and being able to sell our state, what's good about our state, while the administration maintains or retains the control through a separate agency to approve any type of incentive that ultimately gets awarded. But the business talking to business is a very important aspect of what Jobs Ohio does.
Where do you think it could improve?
It's just begun. I think that it's heading in the right direction. It's on the right foot, and I think we need to keep moving forward. And they need to, as they have been doing, continue to reach out to businesses across the country and let them know what's good about Ohio. And I've heard this directly from site selection, folks who were in Ohio last weekend, for example, from out of state, one from Texas, one from Chicago, who specifically said, we are now looking at making recommendations for companies that we work with to move to Ohio. We now, where Ohio was not on their radar screen, Ohio is on their radar screen, and there is no doubt that's because of some of the work that Jobs Ohio does. Okay,
I'll end with this. Obviously, Governor Kasich's going through a re-election campaign here. What do you see as the future for yourself?
Well, I'm at this point running for re-election with Governor Kasich. We're going to be focused as long as we can on the issues that matter to Ohio, making sure that we're still creating jobs and the economy keeps heading in the right direction. But there are elections every 4 years, and we plan to run for re-election.
All right, you heard it from her right there, so stay tuned on that one. We'll have more on the Roundtable coming up.